So today we're going to talk about colic and then a couple other things. So this is part of your diseases, your both HB and HA standards. So who can tell me what colic is? Right.
Like a stomachache for horses.
A stomach ache for horses. I like it. Anybody have anything else?
They can get all twisted.
They can have twisted intestines. Yep. So colic at its basis is abdominal pain. There are lots and lots of types of colic and reasons for colic, but colic in a word is abdominal pain. Anybody ever hear of a baby that's colicky, like a human baby? All right, that usually means they're gassy, their belly hurts, and they scream all the time. All right, horses don't typically scream, but they get that same belly ache. All right, so certainly our number one medical emergency in horses is going to be colic. Maybe I need to use this.
Oh,
Why won't it advance? Okay, did your slide move, Miranda? Excellent. All right, so colic means abdominal pain. What can cause abdominal pain? All right, lots of things. Feed changes, changes in weather, too hot, too cold, too wet, too dry, you pick it, horses don't like it. Too much grain, so certainly horses that get into the grain bin and really overindulge, but even just changing grain too quickly can cause abdominal pain. Too rich of pasture, so especially this time of year as we're getting close to spring and the grasses are growing, we need to watch that. Poor quality pasture as well, so horses that don't have good feed intake, horses that are dehydrated, so did the water not work, did you forget to fill the water, did it freeze, were they out on cross country and lost a lot of water during sweating, so lots of reasons for dehydration. Sand colic. Do we see a lot of sand colics around here? No. Where do we see sand colics? In the desert. All right. So anywhere where you have really sandy soil. So typically along the coast, anywhere where, you know, even South Carolina, Florida, certainly California, see lots of sand colics. Their soil is much more sandy. Our soil has a lot of clay in it, and so we tend not to see the sand colic. But we can certainly see it in this area if your horses are being fed in an arena, in an outdoor arena, or in the indoor and they're picking through scraps of hay that are on sand. So other infections, fevers, there's many causes. So we talked last week a little bit about Potomac horse fever. That can certainly cause abdominal pain. Anytime we change their routine, so they're on stall confinement for a lameness, they can then become colicky. Our stall vices, so cribbing especially, predisposes them to one specific type of colic. So too much water, you know, I guess the theory here is so you take a hot horse that just ran cross country and they gulp a ton of water. Sometimes that can make their belly ache, that they get their stomach just too full. But typically we, you know, obviously don't want to withhold water from them for too long. Obviously too little water leads to dehydration, leads to colic. Any sort of stress. So we certainly get those stress, gassy colics that are short-lived, and horses will get stressed out over anything. They were traveling, you changed how much they worked, you moved them to a new barn, you put a new horse next to them, all kinds of things can set off their digestive system. So what is causing that abdominal pain? All right, so this is where we have many different types of colic. So you get people who get really scared of the word colic because it can mean twisted intestines, and that's probably the worst case scenario, is that we actually have a twist. But there's lots of other things. So just a gassy horse, typically those are our stress colics, spasmodic colic where they get crampy, impaction. So certainly those dehydrated horses or horses that are on poor quality feed, pasture or hay, are more likely to get an impaction. Also horses that eat their straw bedding then would be more predisposed to that. Enteritis. So we think about this more like in humans, like the stomach flu. So you actually have an infection or inflammation of the small intestine. Obstructions can happen, whether that's a foreign body, a worm impaction, an intussusception. Who knows what that word means? Intussusception. Anybody? Inside, actually, that's a good start. So an intussusception is where the intestine actually telescopes in on itself. So where you're supposed to have that normal peristalsis where the intestine just kind of moves up and down to push the food through, it actually starts to like eat itself. And so part of the intestine goes in to the other side of the intestine. And so we get this double thickness of intestinal wall, but then a very tiny little lumen where the intestinal contents could go. So that's an intussusception. Very typical for one type of colic. So anybody know what can cause a severe intussusception in horses? I guess maybe two, I should say. There's two diseases I think about that may lead to an intussusception. There are two types of parasites actually. Negative. So roundworms, certainly, or ascarids can lead to an intussusception, but also tapeworms. So tapeworms actually like to sit right at the ileocolic junction, so where the ileum leads into the colon, and at that cecum there. And so oftentimes that ileum will actually kind of get engulfed into the cecum. That is a surgical emergency. But most often if we see that type of colic, we also find tapeworms in there.
Where it says vices, it says bolting? What?
So bolting their feed. So where they eat their food too fast, they bolt it. Not like bolting, they're running away from you. So bolting their feed, yes, sorry. Certainly more likely to see them choke with that, but we can see them colic as well. So large amounts of food without enough water to help push it on through, or saliva. All right, so we talked about our parasites, and then we've got our large colon. So we can have a torsion or a volvulus, and that's where it twists around or moves in the wrong location. Displacements typically are not cutting off blood supply, but that intestine is where it shouldn't be. Peritonitis, so you've got an infection. Neoplasia, so cancers and that, strangulating lipomas, things like that. So lots and lots of stuff we're going to cover. So what causes abdominal pain? So it's typically the GI tract, all right? So we're going to primarily focus on gastrointestinal causes of abdominal pain, but certainly you could have pain from other things within their abdomen. You don't like my little cartoon there?
The lightning bolts are hurting him.
The lightning bolts hurt him, yes.
And all the horse is like, oh, the other horse looks like it's smiling.
All right, so other things that can look like colic. So things that are wrong with their reproductive system. So a uterine torsion. Typically this only happens when they're pregnant, so that uterus will twist with the weight of a baby. But those mares will become very colicky, but it's not their gut, it's their uterus that's hurting them. So dystocia, if they're trying to give birth to a foal but can't, it's positioned incorrectly. If they've retained their placenta after foaling, that will cause them to get very sick. And then granulosa cell tumors or tumors of the ovary can also cause colic-like symptoms. So sometimes you can't figure out the difference, but certainly giving your vet all of the information will be helpful. Like, hey, this mare is pregnant, it's due in so many months, will be helpful. All right, the urinary system's also in their abdomen, right? So bladder or kidney stones can happen, not very common, but we do occasionally see those as causes of abdominal pain. A ruptured bladder, definitely an issue in our very young horses. Our newborn foals can have a ruptured bladder most commonly. Certainly can happen at any age, but it's going to take a ton of trauma to cause that in an adult horse. All right, so the respiratory system, this technically is not in their abdomen, but because it is walled off from their abdomen with one structure. What is the structure that divides the two cavities? The diaphragm, excellent. So pneumonia, pleuritis, pleuropneumonia, anything that can basically cause severe infection of the respiratory tract can also make them look colicky. All right, so a horse that's laminitic or tying up, so maybe their muscles hurt or their legs hurt, so they're laying down. That can be misinterpreted as colic signs. Obviously, once you look at them more closely, kind of figure out what's going on, we can start to sort some of that out. All right, so the cardiovascular system. So when we talk about cardiovascular system, we're going to talk about all of the vessels, their heart, and different areas that can cause a problem. So large vessel thrombosis used to be very common with what type of parasite? Basically, you get a big blood clot. Anybody know what parasite predisposes them? Bloodworms, excellent. Which ones? What's another name for a bloodworm? Strongyles, excellent. Which ones? The big ones, large strongyles. All right, so last time we talked about a little bit, yeah? We talked about the strongyles a little bit? Yeah, okay. So the large strongyles, do we see a lot of those anymore or not? No. So we don't see this very often anymore, but we used to. And certainly with some of our dewormer resistance, we're worried that it could come back. So large strongyles associated with thrombosis. Aortic rupture or acute hemorrhage. Honestly, most of these horses die before we actually notice that they're sick, unless you're literally watching them when it happens. This is a very common cause of sudden death. So we don't always see them flopping around in the moments before. Uterine artery rupture. So again, these are mares that are typically have just delivered a foal. And that artery can rupture and cause bleeding into their abdomen. If we catch them early enough, we can save them, but they can bleed out from that condition as well. All right, so a myocardial infarction would be basically like a heart attack, very uncommon in horses. And pericarditis would be inflammation of that heart, the covering of the heart. Again, not as common as a lot of other things we're going to talk about. All right, so there's lots of things of the nervous system that we talked about last week even, but equine motor neuron disease, anybody ever heard of that before? So it's basically a nerve degeneration in horses, tends to affect their back end first. We talked about tetanus last time, right? What does that cause? Everybody's got their arms out. What does that mean? So a sawhorse stance or rigid paralysis. All right. So what about botulism? What do you remember about botulism? Flaccid paralysis. Flaccid means they don't have muscle tone. Everything is kind of loose and jiggly. So these horses tend to be super weak. So what do weak horses tend to do?
Lay down all over.
Lay down. They don't want to get up. They don't want to eat. Sometimes they'll actually drool or drop food out of their mouth. So these horses are very commonly confused with the colicky horse because they want to lay down. You try to get them up, they walk 4 steps and they lay down again. Not because their belly hurts, but because they can't stay standing. Seizure conditions, again, uncommon in horses, but oftentimes can be mistaken for other things. All right, so we started through some of these GI signs. All right, so these are things that would be confined to the gastrointestinal system. So gastro means what? Stomach. And intestinal means obviously intestines, right? So from the stomach to the intestines. All right, so this is what the equine digestive system looks like. So you see the placement of the stomach is maybe a little far forward on that horse, but it lies just under the diaphragm. All right, so in the horse on the bottom, so it's kind of under the blue lungs there. So you really can't get to it or feel it or touch it or even ultrasound it very well because it is very centralized in the horse. So how do we tell if there's a problem in the stomach? You tube them. All right. Why do we need to tube them? So we see if anything comes out, because what can't horses do? They cannot vomit. Excellent. So it's a one-way street. So things go, digestion starts where? At the mouth. Excellent. What helps digestion at the mouth? Saliva and chewing of the food. All right. Where does that food go? Down the esophagus. Excellent. Name me a disease that affects the esophagus. What if they bolt their feed?
Colic.
Choke. Excellent. It is a disease.
Choking and
Sure. A condition? Okay, it's a condition. So what condition affects their esophagus? Choke. Excellent. All right. So choke would be the most common thing we see there. So things go down into the stomach. It kind of takes a right angle turn as it gets to the stomach, which is why it doesn't come back up. If anything's coming back up and out their nose, they're typically choked. All right, because it hasn't made it all the way to the stomach yet. So that's our very common, easy indicator of, are they choking? Is there food material coming from their nose? Because there shouldn't be. All right. So again, it's sometimes confused with the colic episode, but if there's food coming out, it tells us something different. All right. So we get our food into our stomach, and yeah, we can have a lot of problems in our stomach. So we can have gastric ulcers. So we actually have to fast horses for 18 hours in order to get a good look at their stomach, because they like to have a little bit of fluid always sitting in there. So we really have to hold them off food for quite a bit of time in order to get a good look at their stomach. But we scope them for ulcers. So we take a endoscope, which is a little camera on a tube, down into their stomach and look around. All right. Many of our horses have ulcers. Okay. Up to 93% of race horses will get stomach ulcers in their career. All right. So that's a lot. And probably up to 60% of our performance horses. The question becomes, how many horses are affected by those stomach ulcers? So even though they have them, they don't always show symptoms, but certainly high on our list for some of our colicky horses. Is that a question? No. Okay. So gastric impactions. So gastric impactions can also happen and cause pretty significant signs of colic. So certainly very dry feeds are more likely to cause an impaction. Somebody give me some examples. Beet pulp. Excellent. Alfalfa cubes or pellets. All right. Something that's been dehydrated. All right. So typically we're going to have to either diagnose these at surgery or with a scope, but many of these can have quite significant colic signs associated with them. All right, so as we move back from the stomach, we get to our small intestine. All right, so a lot of our horses have a very short-lived colic episode, and we term that a gas colic. So they got a little gassy, a little spasmodic-y, too much movement in there, and they get crampy and they hurt. Those typically pass quite quickly, but the horse can be super uncomfortable. So some of them, you know, although they look like they're dying, if they're fine in 10 minutes, it was probably a spasmodic colic. All right, what kind of horses get ascrid impactions? Foals? Young horses. So anything under 18 months of age would certainly be at risk for an ascrid impaction. How often do we deworm young horses? Who's there? Every 2 months. So we typically deworm our babies quite frequently. Ascrids have a very short life cycle, which we'll talk about later, that they can actually, you know, as soon as you deworm them within days, that we can start to see new infections start, and they can be adults within a couple of weeks. So we have to stay on top of those babies. All right, strangulating colics, much more severe. These are surgical colics. So this horse is not going to be able to be fixed medically. They're going to have to go to a hospital and get fixed. So strangulating colics, typically either a twist or a tumor that wraps around the intestine, strangulating it, causing lack of blood flow. These are very, rapid medical emergencies. Once that intestine dies or doesn't have blood supply for long, that horse doesn't have long to make it if we don't get him on the surgical table. So if we're afraid of a strangulation colic, we're going to ship him to the hospital sooner than later. All right, we talked about intussusceptions. That's where the intestine telescopes in on itself. And then inflammatory types of colic. So anybody know what this is called? What an inflammatory type of colic would be called? So we call it enteritis or anterior enteritis, meaning it affects the front half of the intestinal tract. So enteritis means inflammation of the gut. So similar to you having like the stomach flu. What happens when you have the stomach flu? You vomit, right? What does the horse do? Their stomach enlarges and gets bigger and bigger because they can't vomit. That same process is happening where there's fluid building up, but it has nowhere to go. So these horses will actually rupture their stomach if we don't fix their problem. So many of these horses end up living with a tube in their nose for quite some time, days to weeks, in order to get all of the excess fluid out of there as we're treating the inflammatory cause. So things like Potomac horse fever, we talked about last time, will cause an enteritis. All right. So these are just some pictures of, the first one's really dark, but it's a horse refluxing. So it has a tube in their nose and stuff is pouring out. There really shouldn't be stuff pouring out of our tube when we stick it down into a normal horse's stomach. All right, the picture on the right is an intestinal tract that has a strangulating lesion. So that purple intestine is all dead and obviously all dilated. It shouldn't look like bicycle tires. It should be all soft and squishy and kind of flat. If it's descended like that to where it's a big round circle, that's a problem. I'm not going to go over all of this. All right, so large intestine. As we go beyond the small intestine, right, we get to the large intestine. What's the fermentation vat called? The cecum. Excellent. So cecal impactions can certainly happen. Why? What's special about the cecum?
It's one way.
It has one way. So its entrance is also its exit. So the food goes into the cecum. It's a blind-ended sac. So the food has to come back all the way up to where it started to get out of the cecum. So certainly we can get some contents in there that aren't being moved very well. We get a little dehydration and then we get an impaction. So colitis would be inflammation of the large intestine versus enteritis being inflammation of the small intestine. What do you think happens with colitis? The colon is inflamed. What clinically do you see with your horse? They're not vomiting. Diarrhea. So typically colitis horses are going to have diarrhea. Lots of causes of colitis. So salmonella would be an infectious cause. So we isolate them for salmonella. Botulism wouldn't, because botulism, we worried about the toxin that's causing that paralysis. So we will see things like C. diff, so Clostridium difficile will cause severe colitis. And we can see parasites as well, leading to some colitis. So this is where we'll also see displacements, torsions, volvulus. Those are just different ways that the intestine can twist around itself. And then our sand accumulations tend to live here. So in our large intestine, they kind of settle out. Anybody know what an enterolith is? Anybody know what a lith, what the root lith means? Stone. All right. So these end up looking like stones. Some of them it can be as big as bowling balls. Basically, if you crack one open, there's usually some small foreign body at the center. It can be as small as a grain of sand. It can be something larger, but basically it just starts building this mineral concretion and it just sits in their large intestine. They tend to be heavy, so they tend to sit at the bottom. And whatever reason, one day it starts to move, whether they get a little dehydrated or a little diarrhea, something happens in this enterolith starts to move and then it blocks the path for everything else to get by. They can have just one large one, or I've seen them have a ton of tiny ones to the point where they look like they ate rocks, but they're actually formed within the intestines. So there are some high mineral diets that we worry about potentially increasing their chances of enteroliths, but usually there's no good reason as to why they start unless there's a foreign body at the center. But causes severe problems when they start to move and get stuck. Obviously, we're not passing a bowling ball out the back end, so those get stuck and need to come out surgically. All right, so our risk factors for our colic. So we talked about young horses being more susceptible to those things like intussusceptions, bladder ruptures, and then we didn't talk about it, but hernias as well. So that's when the intestine is where it shouldn't be, right? So anybody name me 2 common sites of hernias? Anybody know where they can happen at? So typically on their body, typically there's 2 types. Basically, it's going to be their intestines that end up getting stuck. But we can have umbilical hernias. So basically, especially in our newborn babies, where that umbilicus doesn't close all the way, their intestines can pop out of their belly button. So very important on our babies to make sure that their belly buttons are closed, that we don't have an opening where the intestine can get stuck. And the other one, if I give you one, can you think of another place? And go back to this picture. Right about there. So this is what we call an inguinal hernia. So it's come out of their inguinal ring. In our male horses, what else comes out of their inguinal ring? Testicles. Okay, so certainly a risk of castrating them is that we open up their scrotum, we pull out their testicles. Now there's a space where if they get a hernia today, it's a really big emergency because we've made a hole through their skin. This is a closed hernia, so there's no intestine hanging out, but it's tracked forward down along its sheath. So these would be medical emergencies where we need to go in there, put the intestine back in the abdomen, close up that inguinal ring, and make sure that intestine's still healthy and alive, that it hasn't been stuck there too long to where it dies. All right, so strangulating lipoma is certainly the most common cause of a strangulating small intestinal lesion. So our older horses, they don't have to be super old. So 18 to 25 is probably our most typical age for strangulating lipoma, but I've seen them as young as like 12, 13, and certainly into their 30s with these as well. A strangulating lipoma is actually a fatty mass that causes no problems, but it tends to live on a stalk. So as that mass lives on the stalk, one day it just loops around the intestine and cuts off blood supply. And the only way to untwist it is to go in surgically and remove it. It's like a bowl of spaghetti. There's no amount of jiggling that typically makes it unwrap in just the same way it got wrapped up. So these tend to be medical emergencies. They tend to reflux, so they have fluid out their stomach because they no longer have a pathway for fluid to move through their intestinal tracts. All right, and then obviously we talked about our brood mares that are at risk for both colon torsions as well as, foaling issues that can cause problems. So our brood mares can get a very large colon twist. So they just lived for 11 months with this growing baby in their abdomen. All of a sudden, this baby's on the ground. And it's amazing how big a baby can be coming from, brand new, how much space that used to occupy. Now there's all this room in there. These mares have a much higher chance of twisting in the very quick post-op or postpartum period. So typically within 48 hours of giving birth, they can have a second problem of a colic episode. All right, so different breeds have been shown to have higher risks for colic. So Arabians are shown to have an increased risk. Impactions of the small colon, very common in our miniature horses. Standardbreds certainly have larger inguinal rings, so we're more likely to see scrotal or inguinal hernias with those guys. But any horse can colic for any reason, just about, as long as it's not like sex dependent. Typically, our hernias inguinally are more associated with male horses, but we can see them in females as well. Females have inguinal rings. They just don't have structures that pass through them. All right, so any horse that has a previous colic history is typically at risk for a future colic episode. Whether it was medical or surgical, it definitely increases their chance of colicking again in the future. All right, so depending on what we're doing with our horses. So obviously our race horses, our performance horses are going to have higher incidence of those gastric ulcers. Pleasure horses that are changing their environment. So if they're used to being just pleasure outside all the time, and then you move them to a boarding barn, you start training them, that certainly increases their risk as well. All right, so all of the management factors that we talk about controlling. So we talked about diet before. So how much grain are they getting? How much forage are they getting? When are they getting it? At what amount? Are we splitting it up? Are they getting it wet or dry? All of that changes their colic risk. So our goal is to manage our horses as close to nature intended, but that's hard when we have show horses or horses that are kept with other horses that we need to manage their diets individually. So anytime we change their exercise, their stabling can increase their risk of colic. So we're taking them to an event or a show that also increases their risks. Any questions on any of that? All right, so how do we know they're colicking? Shout out some signs. Laying down, pawing, looking at their stomach, not eating, biting at their sides, not drinking, not producing manure. So certainly ADR is a word we use, or a term we use a lot. Ain't doing right. All right. So they're not acting normal. Whatever that is for that horse can be off. So certainly behavioral changes. Certainly separating themselves from the herd. So if everybody's in the pasture or standing at the gate and there's one horse out at the back field, maybe there's something wrong with him. All right. Any other thoughts? I think those are our big ones. All right. So knowing the horse is very essential because for some horses, it's normal for them to separate themselves from the herd. They're the low man on the totem pole. They don't want to come in. That may be normal for that horse, but abnormal for a different horse. All right. Certainly if your horse is not eating, that's a concern. All right. So all the pictures, laying down, looking at their sides, rolling, and sometimes they just look like they're sleeping, but that horse may not be a horse that likes to sleep when other horses are around or when you come into the barn and they don't jump up to greet you. Those could all be signs. All right, so what do we do? First step is don't panic and make sure everybody's safe. All right, I'm always a safety Nazi because horses are dumb and they're even dumber when they're hurting because they don't think about you or themselves and they're just worried about their belly. So figure out what's going on. All right. So what is the horse doing? Are there other injuries? I mean, sometimes we find them cast in their stall. What does that mean? They're stuck. All right. So my question is always, are they just stuck or did they get stuck because they were colicking? And sometimes it's the chicken and the egg. Which one came first? If they're cast long enough, they can then colic because they've been upside down or sideways or not eating or whatever. Or they could have just gotten cast because they were colicky. All right, so look for any other injuries. Have they hurt themselves? Certainly bad colics will start to beat up their eyeballs. So their orbits as they're rolling on the ground aren't meant to be flopped against the hard ground. And so they'll start to get abrasions or swellings. If they've been colicky all night, we'll see rubs on their hips where they've been rolling and they were actually rubbing the hair off of their, those bony prominences. All right, if it's safe to do so, we try to get vitals on them, right? What vitals do we want to collect? TPR, excellent. What's the normal temperature? You'll see a lot of different ranges out there. I like 99.5 to 101.5. that covers most normal horses. We certainly sometimes have some outliers. Our newborn foals tend to be a little bit warmer, and that's normal, but 99.5 to 101.5 are the numbers I have in my head. Okay, pulse. Normal.
36 to 34.
I'll accept 36 to 44 for sure. Some horses can be as low as 32 if they're fit. And really anything beyond 44, unless they're a mini, or unless, you know, sometimes I don't get a true resting heart rate on them if they're nervous because I'm there. But if you're their owner and you're taking it, they really should be under 44. Excellent. What about respiratory rate?
26 to 38.
8 to 20 is my acceptable range. So 8 to 20, they're slow breathers. They've got a ton of lung capacity when they're just at rest. It doesn't take a lot of breaths per minute. So 8 to 20. All right. What else are you going to look for? Vitals wise. So certainly labored breathing for sure. Mucous membranes. Excellent. And their capillary refill time. What does that mean, Susie?
It's like when you push on their gums and then you like count how long it takes for the blood to come back.
Excellent. Do you know what that's telling us?
Like how the blood flows.
Excellent. So it tells us about perfusion or blood flow at the very distal end of their vessels. So their capillaries are the smallest vessels. So we usually use their gum. You could also use on a mare their vulva. And you can also use their eyelids if you've got a horse that won't let you touch their mouth, if they're phobic from, you know, they don't like their mouth touched. There are other ways we could try to look at that. So yes, we're going to press down on their mucous membranes, let up, and count how long it takes to come back. What's normal? I say less than 2. Some people say less than a second and a half. If you count to 2 and their color's not back, it's not right. All right, so less than 2 seconds is going to be normal. Some of them come back super fast and it's like you can barely see it. You got to be quick to look. And others you can count to 2. But if it takes longer than 2 seconds, that's not right. All right, so once we've established some vitals on our horse that can help us know if that's normal or abnormal, and hopefully you all know your horse's resting parameters and they're recorded in your record books. Excellent. That way, if you're distressed over it, you can quickly look it up because your record book's handy, see what normal is. Okay, good plan. All right, so we're going to provide fresh, clean water for them. We're going to take away any food though. If they're not feeling well, we don't want them eating. And you're going to call the vet. All right, walking has always been a mainstay of maintaining our colics. Our goal is not to walk them to death. We should not be making them exhausted by walking them. What is the goal of walking? So sometimes some digestive movement. What else? So they don't lay down or hurt themselves. So sometimes it's more of just a distraction of we get them moving. Some of our mild colics, gassy colics, spasmodic colics, it's enough to get things moving and they stop colicking. But for our others, the goal is it gets their mind off of it for a second. It gets them maybe to a safer place, to an arena, outdoors, to a paddock, somewhere out of their stall, and see if that doesn't help them. You're then in a bigger space that if they do lay down, we're not at risk of getting hurt or them getting cast. And so our goal is just to get them moving and then see if they will rest comfortably. All right. Anytime you've got a thrashing horse or an uncontrollable horse, just call a vet. Don't try to get vitals on something that's trying to fall on you. There's no point. All right. Their comfort level is going to tell us all we need to know. All right. So trying to keep calm. You don't need a ton of people. It's nice to have a friend or two in case something goes awry, but you don't need the whole peanut gallery there watching. All right. Like I said, horses can be unpredictable. So getting them to an open, safe area is key. If you're not able to do that, leave them in their stall. All right. So different mucous membrane colors. What color should they be? Pink to light pink. Excellent. So typically horses are a little more pale than like your dog or cat, but it should be a pale pink. All right. What's the one on the left? Too pale or even grayish looking. Yep. What about the one on the right? Too pink. So oftentimes we'll see that with inflammatory or infectious conditions. So colitis, enteritis, oftentimes they'll have a fever when their mucous membranes look like that. All right. What about the one at the bottom?
It's not.
I know our color's not great, but all right. So this one's almost a little yellow, a little jaundiced looking. What do you notice in the middle of the picture? A thumbprint. Yeah. Yeah. His capillary refill time is really not good if we can get a picture of it. Okay. So we talked about our respiratory rate, oftentimes 12 to 16, but really anything 8 to 20 would be acceptable. All right. A resting heart rate, you know, super fit racehorse, they may be down to 28 when they're just resting, but 32 to 44 is probably most common. All right. Our temperature, again, 99.5 to 101.5. All right. So when you call the vet, give them all of your information. All right. What made you concerned? Anything you've done differently? Did you start a new food? Did you change them to a new pasture? All of those things we talked about. You know, are they pregnant? Do they have a problem? Did you do anything recently that could have changed any of that? And then certainly if you can get their vitals and you can tell the vet that, that can be very helpful. All right. So again, don't walk them to death, but walking them a little bit can help move things along, keep them safe while you're waiting. All right. So what do we do when we get there? All right. So we're going to assess all of that again. We're going to look at, are they feeling any better after walking? What are their vitals now? Do they have gut motility? What does that mean? Gut sounds. How do you determine that? All right, excellent. You stick a stethoscope on them. Where? So technically, we're not looking for stomach movement. We're looking for intestinal movement. Yeah, flank. Excellent. So we're going to look in the flank area, both high and low. So behind the rib cage in front of the point of the hip, and then down under on their abdomen. So typically we're going to look in what we call 4 quadrants. So high and low, left and right. All right. We're probably going to stick a tube in them. We may do a rectal exam. Unfortunately, horses have a very large barrel. We can only assess portions of it. So we can get the stomach, we can get the back end, we can feel if anything's malpositioned, distended, firm, those kind of things. All right, so we may decide that this horse is too sick to be helped at home and we ship them off to the hospital, or we may say, okay, we can treat this horse on the farm. All right. The biggest thing with colic is trying to prevent it, right? So all of the things we typically talk about in our other meetings, we'll go over all of that. Our physical exam, our dental, our, you know, preventative cares, parasite programs, all of that will reduce their colic risk factors. All right, again, early intervention. So the longer we wait, the more severe these colics can become. If they have a strangulating lesion, they can get to the hospital, get everything untwisted and not have to lose any intestine. The longer we wait, the more chance that we have to actually remove portions of their intestinal tract. And that certainly makes for a more expensive surgery, but also a poorer prognosis that they'll fully recover from that. All right, so being prepared. So knowing your horse's normal habits and behavior, knowing their normal vitals, having access to your veterinarian, and then first aid kits, you know, will help you attain some of that information. What is laminitis? Artie. Separation of the lamina. Okay, it can. But at its very definition, there's no separation. Inflammation of the lamina. Excellent. So inflamed lamina. Itis means inflammation. What are lamina?
The little velcros.
The little velcros. It holds the coffin bone where? In place against the hoof wall. So you've got 2 types of lamina. One type of lamina is on the coffin bone, and the other one is on the hoof wall. So that Velcro is between the hoof wall and the coffin bone. Explain that. What do you say?
There's the hard Velcro and the soft Velcro.
Excellent. So the hard Velcro is on what side? The hoof wall. And what's that called? Insensitive lamina. All right. So then the other side would be the sensitive lamina. Why is it called that, Emmy?
Because it's the soft one.
So when your farrier trims their hoof wall,
They can't,
they don't
there's no nerve.
feel it. There's no nerves. All right. If they injure their hoof wall or any part of their body, what happens? They bleed. All right. So it has blood vessels as well as nerves. All right. So that's our sensitive lamina. All right. So laminitis is going to refer to any condition that causes disruption of blood flow between the sensitive and insensitive lamina. All right, so we can have very chronic conditions as well as very acute conditions. All right, so the coffin bone, what's another name for the coffin bone?
P1, 3.
P3. What does P stand for? Phalange. All right, so P3, otherwise known as the coffin bone, is entirely engulfed within the hoof, right? So inflammation in there has nowhere to go. So what happens when you hit your thumb with a hammer? Susie?
That's not funny.
All right, it swells, right? It gets bigger. All right, what happens to the horse with laminitis?
It swells, it has nowhere to go.
It gets more painful, right? Because there's nowhere for it to go. Artie, what happens when that inflammation builds up? There's swelling. What's the word?
Inflammation.
What's, well, we already have the inflammation. What then happens as it tries to swell?
Separation.
Separation. This is where you come in. Yes. So initially we just have inflammation. Eventually we get to separation if we don't control that inflammation. All right. So certainly our more chronic conditions are going to be associated with separation, whereas our acute conditions are going to be associated with pain, heat, throbbing, that kind of thing. All right. So you guys all know your anatomy now, right? So we're at P3, we're all the way at the bottom. Our goal with that Velcro is that we are parallel, right? The hoof wall and the coffin bone really should be parallel. That Velcro has never been used. It's nice and tight from the top to the bottom. All right, so I tend to use the word laminitis because it can refer to any stage of that condition. The common term is founder, but most of the time when people are using the word founder, it's going to imply some separation or rotation. So I tend not to use that word in the early stages, but we can certainly see those old foundered ponies where it's happened over and over again, and we certainly have that rotation. So what does acute mean? Right now, it just started. All right. So acute laminitis is typically going to be approximately 72 hours in length. All right. Beyond that, we get to more chronic stages. All right. So you will not see separation in an acute laminitis. It hasn't had time for that Velcro to fall apart yet. All right. And we certainly can see both. We can see a horse that has chronic laminitis that is now having an acute flare-up. So we can see the two of them together. All right, so it can affect one or all of the feet. Most common, we're going to see it as a bilateral front foot disease. All right, so both front feet. The bad ones, we'll see it in all four. All right, so over time, we can get that separation that separation can happen in two directions. All right, we most commonly think of it as rotation. What causes the rotation? Excellent. So the pull of the deep digital flexor tendon is what's actually causing the rotation. All right, why? Yeah, so the forces of it, the Velcro or the lamina should hold that bone to the front of the hoof wall. What is the function of the deep digital flexor tendon? To flex their coffin bone. So each tendon flexes a different portion of their foot. The deep digital flexor is deep to the superficial, right? So it's closer to the body, but it goes all the way down to the bottom and inserts on the bottom side of the coffin bone. So as we disrupt the forces up front, the normal deep digital flexor tendon pull will slowly pull that bone away. What, you didn't like my pictures?
No.
Oh, horses that have a bad design. Yes. Yes. They are fragile, more fragile than they should be. All right. So what is the exact mechanism? There's a lot that goes through here. There's a lot of pieces of the puzzle that we actually know, and there's some pieces of this puzzle we actually haven't figured out. All right, so lots of different causes. So just like we talked about colic, having a lot of different types of colic, we have a lot of different reasons for a horse to have laminitis. So although it's displaying in their feet, it can be caused by systemic conditions. So colicky horses now have a higher risk of foundering, depending on what's causing that colic episode. Did they get into the grain bin? Are they eating too many snacks? Did you change their diet unexpectedly? Did you throw them out on pasture? These kind of things can all affect their feet. All right, anything that releases toxins in their body can cause them to colic. So any disease that causes high fevers. What did we talk about last time with the fever? Potomac. So Potomac horse fever, my number one complication long-term in that is laminitis. We can oftentimes get them through the colickiness. We can even get them through the diarrhea. The question is, can we get them through the laminitis? And so one reason to vaccinate is they tend not to progress through the stages as fast, gives us more time to intervene, and less likely to have a severe complication like laminitis if they're vaccinated. All right. We talked about colic, diarrhea, so salmonella, C. diff, anything like that. That retained placenta we talked about earlier can cause them to first be colicky and then be foundery. So all kinds of badness. All right, so road founder. This is a little bit different in that it's caused by mechanical forces, so excessive concussion. So more common in our Amish horse population that are pounding the pavement and really going down, firm roads. We can see it with other conditions as well, but that's going to be our most common to see a road type founder. Support limb laminitis. This is the one time you'll see it in just one limb. So do you know what that means, support limb? So they've injured their other foot for whatever reason. They pulled a tendon, they stepped on a nail, they broke a bone. Now we're putting too much weight on our other foot. Their legs are spindly. They need all four of them to stand on. When they're only standing on three, they put too much weight on it and they cause excessive mechanical forces there. Black walnut. So when we get to our toxic plants, that's going to be our number one symptom of black walnut poisoning. Both from pasture contamination or more commonly from shavings. Do you know how long they have to be on black walnut shavings to cause a laminitis episode? Somewhere in between there. So most people will say 3 to 8 hours, that it doesn't take a long time of them standing on black walnut for them to start showing symptoms. So it's not like weeks later. It's typically pretty fast that they start to show those symptoms. All right, so we want to make sure that we're walking our pastures. We don't have black walnut. All parts of the black walnut tree are poisonous. So whether it's the tree, the shavings, the leaves, anything that they could be standing on. All right. And then certainly other conditions like high doses of steroids, medical problems, things like that, that can lead to laminitis. All right, so certainly metabolic diseases. Anybody tell me a metabolic disease? Cushing's. There's two that we think about. So insulin resistance is type 2 diabetes. So you're right. So type 1 diabetes, very unlikely in horses, but a type 2 diabetic condition or insulin resistance certainly will cause them to founder. All right. Ponies, Morgans, donkeys, miniature horses all seem to be at increased risks, as well as our heavy breeds like our draft horses. All right, so that horse that gets into the grain room, again, could have both of these diseases. They typically colic first and then founder second. What does this horse have? Cushing's, good job. All right, so what do they look like when they have laminitis? Their feet hurt, excellent. How do you know their feet hurt?
They're like limping.
They don't want to walk, they limp. They rock back. So they try to weight bear on the heel portion and not on the toe. All right. They may be slow to come out of their stall. They may be really resistant to turning. Those shearing forces as they turn tend to hurt the worst. What else will you notice? They're hot. Their feet can be actually warm to the touch for sure. What else that you guys have been practicing? Feeling? Their pulses, what do they feel like? They're throbbing, like when you hit your thumb with the hammer. That pulse throbs. So the pulse rate is not different, right? What is the pulse? A measure of their heart rate. All right, they might be a little increased if they're painful, but it's going to be the same number as measuring their pulse, right? It's just going to be a higher intensity. So that throbbing sensation. All right. So this horse here is rocked back, so doesn't want to move forward. Oftentimes we'll say they look like they're walking on eggshells. Like it looks like Susie's horse on a gravel driveway. All right. So that foot sensitive horse can look kind of similar, but then they kind of get that backwards look to them where they want to lean backwards like a sawhorse. All right. So what about if this horse has had chronic signs of laminitis? What do we see when we look at this horse just visually? Long toes. Excellent.
Widened white line at the quarters and toes with the currents of swings.
Thank you. Thank you. So we're going to see a wide white line. Why? What is the white line?
It's the wall leading the-
That's our lamina that's growing out. So that white line is our lamina. So if we have what process, Artie? Separation, we can actually see that on their sole. All you have to do is pick their feet and you will actually notice that. All right, what about if you're looking at them from afar? So long toes. Almost see like an elf shoe, an underrun heel. So actually their heels grow faster than their toes because they're not affected. That blood supply is affected in the front. So it actually causes their toes to grow slower, but their heels grow faster, pushing their feet out like a little elf shoe. All right, what else will you see?
something about it.
Rings. Anybody ever see rings on a horse's foot? Well, they look almost like tree rings. So as they're growing down, it's basically showing you abnormal stages of growth. So especially those horses that have had a single acute laminitic episode or go out on the pasture every once in a while, you'll actually see a ring every time we have an episode. How long does it take for the hoof wall to grow out? Up to a full year. So between 9 months and a year for them to grow a full hoof. So you can determine how long ago they had a laminitic episode by where that ring is or that disruption in growth has occurred. All right. Horses that have rotation or sinking of that coffin bone will then have dropped soles or very flat feet. So sometimes we don't know for sure, but those would be indicators of maybe I should take a radiograph and see where this horse's bone is, because I can't see that by looking at the outside of this horse. And if this horse has had farrier work done, it changes all of that. So you can mask or, you know, remove some of those signs from a horse by treating them. All right, so this horse is fat on a grassy pasture. It's probably just waiting to founder one day, right? All right, so this is that elf shoe appearance, right? So this horse obviously hasn't had his feet trimmed in a while, but it's amazing how much that growth can really change even in a short period of time to where they want to have that elf shoe appearance, all right? Obviously not normal, but a little rough, All right, so the sooner we treat these guys, the better. So when do you think we should intervene?
Right away.
In the acute stage. So we have the most ability to change things in the acute stage. Why?
Separation.
There's no separation. It is severe. Things are happening, but there's no separation yet. So our goal is to prevent it from separating. Because what happens when you undo the Velcro for the first time? It never goes back the same. No matter how hard you try, your soft Velcro and your hard Velcro just don't go back together, right? So our goal is to initiate treatment early. What are some things we can do? What are we going to do? But it's already started. We've identified this horse as an acute laminitic, so we're going to stop anything we can, right? So we're going to stop any grain. We're going to take them off pasture, right? The prevention's over, but now we're starting into treatment. So remove them from any inciting causes. Ice their feet. Excellent. Icing only works in the acute stage. So a chronic horse it has no effect on. So it only works in those first 72 hours. So we will use icing sometimes as a preventative. The horse that got into grain or got out on pasture when he shouldn't, bring them in, ice their feet, try to stop any changes from happening, reduce the swelling. All right. And we've got to figure out what caused it, right? What could have caused it? Figure out some things. Black walnut, lots of grain. Too much grass.
Too rich.
All right, they've got insulin resistance. They've got Cushing's. Maybe we didn't know it, but we figure it out, right? What if they have Potomac horse fever or they retain their placenta, right? We're going to treat the primary disease as well as the laminitis. All right, so dietary restriction, it may be soaked hay only. That's all they get is hay that's been soaked, remove the sugars, and that's all they're allowed to eat until this is over. All right. If they got into grain, we may actually tube them and treat them with mineral oil or activated charcoal to try to eliminate that excess grain from the digestive tract. All right. We're going to treat them with things that stop the swelling. So anti-inflammatories, stop the itis. Okay. We may then start additional medications as well. All right. Mechanical support is key in these guys. Deep sand bedding is great. It's just hard to get a stall filled with sand. I've had clients do it, but it takes a lot of sand. It's got to be deep, and it's not as much fun to clean a stall that's filled with, you know, yards and yards of sand. All right. So then we've got farrier care. So a good farrier is going to be key for that entire next year as we're growing out this new foot. All right. So it's not a one-time thing. All right. What's our long-term outlook? All right. Some of these horses have uneventful recoveries and they go on to lead normal, useful lives. All right. That's our goal is we intervene early, we stop the process, and we pretend like it never happened. All right. Certainly others, depending on the inciting cause, how long it took us to recognize it, how long it took us to stop the process, may get so bad that we have no option but to put them down. All right, so obviously our x-rays are really going to tell us what they look like, how much separation there is, how much rotation there is. Again, in that acute horse, we may not see anything on an x-ray. So we have to remember that that process is still happening. The good news is it doesn't look like there's chronic laminitis, so they are still useful to take in the short term, but we'll get even more information if we wait 2 to 4 weeks and take another x-ray. There is a thumbtack, and we'll oftentimes use a thumbtack at the point of the frog to help us identify it on an x-ray. So it's actually not penetrating anything there. It's just in that dead portion of the sole of the frog. And we will use that thumbtack to help identify structures. This one has this piece of metal. The line across the front is actually a piece of metal that's on their hoof wall to help us make measurements. These were much more important to do before we had digital x-rays when they were harder to see. Our digital ones, we can change contrast and oftentimes identify those structures without having to mark them. But a lot of our old x-rays, you'll still see markers in them. All right, questions on any of that? I'm going to stop there today.